How to prevent measles. Measles is a highly contagious viral infection that can cause serious complications and even death. Fortunately, there are several steps you can take to prevent yourself and others from getting measles. In this video, we'll talk about what measles is, how it spreads, and most importantly, how you can protect yourself and others from this potentially deadly disease. So make sure to watch till the end. What is measles? Measles is a highly contagious viral infection that can cause a variety of symptoms, including fever, cough, runny nose, sore throat, and a characteristic red rash. It is caused by a virus called the measles virus, which belongs to the paramyxovirus family. The virus is highly contagious and can spread through the air via respiratory droplets produced when an infected person coughs or sneezes. Measles is a global health concern, but it is particularly prevalent in regions with low vaccination rates. According to the World Health Organization (WHO), in 2022, there were over 20 million cases of measles worldwide, with the highest number of cases reported in Nigeria, the Democratic Republic of the Congo, and Ukraine. Despite being preventable through vaccination, measles remains a leading cause of death among children under the age of 5, accounting for an estimated 200,000 deaths in 2022 alone. How does measles spread? As we mentioned earlier, measles is highly contagious and can be spread through the air via respiratory droplets produced when an infected person coughs or sneezes. These droplets can remain suspended in the air for hours, allowing the virus to be transmitted over long distances. Measles is so contagious that if one person has the virus, it can spread to up to 18 people in close contact with them. The virus can also be spread through direct contact with infected individuals or their bodily fluids, such as urine or blood. Additionally, people can become infected by touching surfaces or objects contaminated with the virus, such as doorknobs or toys. Once a person is infected with the measles virus, they are contagious from about 4 days before the onset of symptoms until 4 days after the appearance of the rash. This means that an infected person can spread the virus to others without even knowing they are contagious. The incubation period. The incubation period refers to the time between exposure to the virus and the onset of symptoms. For measles, the incubation period is typically between 7 and 14 days, with an average of 10 days. During this time, the virus is replicating and spreading throughout the body. Some people may experience a prodromal phase, which includes symptoms such as fever, cough, runny nose and sore throat. The rash typically appears 3 to 5 days after the onset of these symptoms. Symptoms of measles. The most common and characteristic symptom of measles is a red, blotchy rash that appears on the face, trunk, and limbs. However, other symptoms may include high fever, cough, runny nose, sore throat, conjunctivitis, and Koplik spots. Koplik spots are small, white spots with a bluish tint that appear on the inner lining of the cheeks. They are a distinctive sign of measles and usually appear 2 to 3 days before the rash develops. While most people recover from measles without any complications, some may develop pneumonia, encephalitis, or other serious conditions that can lead to hospitalization or even death. How to prevent measles? Now that you know what measles is, how it spreads, and its potential severity, let's discuss how you can prevent yourself and others from getting this potentially deadly disease. 1. Get vaccinated. Vaccination is the most effective way to prevent measles and its complications. The Centers for Disease Control and Prevention, CDC, recommends that everyone receive 2 doses of measles vaccine, the first at 12 through 15 months of age, and the second during preschool years. A single dose of measles vaccine is 93% effective at preventing measles, and 2 doses provide up to 97% protection. Additionally, the vaccine is extremely safe, with millions of people having received it without experiencing any serious side effects. However, if you have never had measles or been vaccinated against it, you may be at risk of infection. It's important to note that measles can remain in your system for up to 75 days, making it possible to contract the virus even if you've recently recovered from it. If you believe you may have been exposed to measles, it's crucial to contact your healthcare provider immediately. 2. Practice good hygiene. Good hygiene practices such as frequent hand washing can help reduce the risk of contracting measles. The virus can live on surfaces for up to 2 hours, so it's essential to wash your hands thoroughly with soap and water for at least 20 seconds, especially after coughing or sneezing. If soap and water aren't available, use an alcohol-based hand sanitizer containing at least 60% alcohol. Avoid touching your eyes, nose, and mouth, as this can transfer the virus from your hands to your body. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing to prevent the spread of respiratory droplets. And dispose of used tissues properly. Clean and disinfect frequently touched surfaces and objects such as doorknobs, light switches, and toys to kill the virus and prevent its spread. By following these hygiene practices, you can reduce your risk of contracting measles and protect others from infection. 3. Avoid close contact with infected persons. If you know someone who has measles, avoid close contact with them. Measles is highly contagious, and you can catch it easily if you spend too much time with an infected person. Close contact means being within 6 feet of an infected person for a prolonged period, such as during a conversation or while sharing a room. If you must be around someone with measles, wear a mask to protect yourself from airborne transmission. Additionally, ensure good ventilation in the room by opening windows or using fans to prevent the buildup of measles virus particles. If you have been in close contact with someone who has measles and develop symptoms, seek medical attention promptly. Early treatment can help prevent complications and reduce the severity of symptoms. Remember, the best way to protect yourself and others from measles is through vaccination. By following these tips, you can help prevent the spread of measles and keep yourself and others healthy. 4. Isolate when sick. If you develop symptoms of measles, it's important to isolate yourself from others to prevent the spread of the virus. Stay home and away from work or school until you have recovered and your fever has been gone for 3 days. If possible, stay in a separate bedroom and bathroom from other household members. Use a separate bathroom if possible and clean it thoroughly after each use. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing, and dispose of used tissues properly. Wear a mask while in public indoor settings and on public transportation, especially if you are not up to date on your measles vaccinations. Avoid close contact with pregnant women, infants, and people with weakened immune systems, as they are more vulnerable to complications from measles. 5. Seek medical attention. If you think you may have been exposed to measles, or if you develop symptoms, it's essential to seek medical attention promptly. Early diagnosis and treatment can help prevent complications and reduce the severity of symptoms. Your healthcare provider will ask about your symptoms and travel history and may perform a physical examination and blood tests to confirm the diagnosis. Treatment for measles typically involves supportive care, such as rest, fluids, and over-the-counter medications to relieve symptoms. In some cases, hospitalized may be necessary to prevent and treat complications such as pneumonia or encephalitis. If you are pregnant and develop measles, seek medical attention right away. Measles can cause serious problems for you and your baby. Conclusion. In conclusion, measles is a highly contagious and potentially severe viral infection that can cause significant morbidity and mortality. Vaccination is the most effective way to prevent measles and its complications. Other preventive measures include practicing good hygiene, avoiding close contact with infected persons, isolating when sick, and seeking medical attention promptly. By following these tips, you can protect yourself and others from measles and help prevent its spread. Do not forget to like this video and share it with your friends and family to raise awareness about measles prevention. And stay tuned for more health-related videos.